David Lay. Hello, David. He's a father, a husband, a grandfather, a clinical psychologist, an author. He's based in New Mexico. And he's also the author of a book that was very important for me that was called The Myth of Sex Addiction. I've asked David to speak about fighting shame in male sexuality.
Thanks. After, let's see, can I pull that out? Oh, okay. Great. After Sarah's talk, I wanted to take a break and run to the bathroom, shave my beard down to stubble. Give me just a sec, I'll be right back. Today, many of us approach male sexuality. Oh, I'm going to step right on this thing. Let's move that. Okay. Today, many of us approach male sexuality with skepticism and mistrust. I understand. It makes sense. It's justified. The challenge is this approach makes things worse and makes it more difficult to change. Most therapists in the United States, most mental health therapists, most of us in the room receive no training in sexuality. I was no different. As a psychologist, the only training in sexuality that I got was how to diagnose paraphilias and sexual disorders. That creates a lens through which we look at sexuality, assuming pathology. And yet, with no training on sexuality, an interesting thing happened. The majority of my clinical career has been focused on sexuality, and male sexuality especially. Perhaps with the last name Lay, I should have anticipated this. But as I worked with male sexuality, I came to realize that men use sexuality. We use it to meet and fulfill deeper needs for acceptance and love and vulnerability. As a man who was born with one hand, I learned to use sexuality as a way to find acceptance and to overcome my personal shame of having a body that was different. But we oftentimes pathologize men for using sexuality because we view sexuality as something that shouldn't be used in that way. I have to ask us why not. Working with sexual offenders, I found the same thing. The majority of males who commit sexual violence and sexual crimes are reacting from places of fear and loss and need, craving connection. Sexual scandals always involve much deeper issues of narcissism and selfishness and unexamined needs. Jian Ghomeshi is a Canadian broadcaster, published a piece just a couple of months ago where he said that his sexual predatory behavior, his sexual selfishness was just a reflection of the growth of selfishness and narcissistic behavior throughout his life. This, I think, is a critical point. When sexuality issues are present, we overattend to them. I call this the sexual shiny object syndrome. Because when sex is there, we focus on that to the exclusion of, as Sarah said, context. I think it's so critical as we look at issues around male sexuality that we consider the context. In New Orleans a couple of years ago, a professor at a seminary was lost to suicide. A couple of days later, or maybe a few weeks later, I think, the college had a conference about the dangers of pornography addiction for the professors and the students, because this man had gone to his leaders and said he was struggling with sexuality and porn. They sent him to a porn addiction treatment program. And so the school used this as an opportunity to teach people just how dangerous pornography is. But the rest of the story is that he died just a couple of days after his name was released in the Ashley Madison extramarital dating website hack. He was struggling with many issues in his life. Pornography was merely a symptom. If I go to my doctor and I'm sneezing, my doctor doesn't say, David, you got a sneezing disorder. You need to stop that shit. Instead, my doctor tries to figure out the deeper causes and context for this. In research around those who identify as porn and sex addicts, it is crystal clear at this point. Porn addicts and sex addicts are not watching more porn or having more sex than anybody else. They feel worse about it. And why do they feel worse about it? Because of the moral conflict that they are struggling with in terms of what they want to do versus what they were taught is okay to do. As a young psychologist working with sex offenders, I was taught when a patient had a deviant sex fantasy, that we should encourage them to think of a stop sign in their head and then to scream stop at the top of their lungs, out loud or in their head. But therapists like myself who follow the research actually had to stop using that intervention because the research found that that strategy increased the intensity and frequency of those thoughts. Recent research in Israel found identical results. As religious people attempt to suppress thoughts of sex, they get stronger and more frequent. And the sad thing is, if you were taught to be ashamed and hate yourself for those thoughts, then your self-hatred and your shame increases, paradoxically. Don't think of a naked white elephant, and if you do, you're a dirty pervert. And right now, everybody in the room is a dirty pervert, thinking of naked elephants. Do elephants wear clothes? I don't know. When I came up with that, Babar, right? He wears clothes. Clinically, it is exhausting and counterproductive to focus on fighting the negatives. So what if instead of the stop signs, we thought of the go signs? What are the things we want to encourage more? What are the things we want to build more? How do we build resiliencies and strengths as opposed to fighting the problems? One of the questions I ask men, who is your sexual role model? How did you figure out, who taught you how to integrate your sexuality into your identity and to think about what kind of sexual being you wanted to be? Most men can't answer that question. Gay men, I find, can answer it more frequently because gay men, as a result of living as a gay man in our society, have had to wrestle with the question, how do I want to make my sexuality a part of myself? Unfortunately, there are lots of negative role models, and frankly, at this point, the only time a man's sexuality becomes a public issue is when it is a problem. We are far more aware of President Trump's sexuality than President Obama's. I'd much rather support and teach people to be sexual like President Obama, but we don't hear about his sexuality. In Albuquerque, you may have heard just a couple of weeks ago, a man was arrested for groping a sleeping woman and interviewed by the police. His response was, as Virginia pointed out, well, the president says it's okay to do this. We have to think about the role models that we're inviting or offering to young men. What happens when young men have no healthy sexual role models? Several years ago, a young man was referred to me. He was 17 years old at the time, and this is a scary young kid. He had thoughts of raping and killing a sex worker. He was isolated, depressed. He was using drugs and alcohol. He had been raised only by women, and he had a tremendous amount of anger towards women in his life who'd emotionally and physically abused and let him down. And he was watching sexually violent, hyper-violent pornography online, simulated rape, etc. Now, research on sexually violent pornography finds that there's about 5% of men, when they watch violent pornography, it increases the chances they will engage in sexual violence. It is critically important in this conversation that we recognize 95% of men don't show that effect. But we're not talking about those guys. I think we should. How do we pick that 5% out? Research by Neil Malamuth, UCLA researcher, and he says really 5 to 7%. We identify those men by 3 factors: antisocial personality traits, substance use, disinhibiting drug and alcohol use, and hostile masculinity or toxic masculinity, misogyny, anger at women. This kid had all of those. This kid was at risk. And I really wanted to tell him, don't watch that violent pornography because it's bad for you, and it increases the chances you'll hurt somebody. But I know as a therapist, if I tell a patient not to do something, I'm inviting them to engage in a power struggle with me. And they may engage in the behavior, but keep it secret because they don't want to let me down. So instead, we focused on all the go signs. We started attending to the depression. We started getting him out of the house. We started getting him using less drugs and alcohol. We started talking about his relationships with women and the traumatic past that he had. The thing that fixed this kid, though, didn't have a lot to do with me. He came in one day, and he was going to college now, and this girl was sitting next to him in college class, and she kept flipping her hair, and he was so annoyed by it. Now, as therapists, you know, sometimes I'm therapist, but especially with young men like this, sometimes I'm just dude. So as dude, I said, you know, sometimes when girls flip their hair, they're flirting with you. He said, you don't know what you're talking about. You're full of shit. All right. I cuss in therapy and speaking because people who cuss more are more honest because we're not filtering the information before we give it to you. So when your patient cusses, they're being really fucking honest with you. So he came back next week and he had a date because I was right. But this kid had never had a girlfriend. He had no idea how to be a boyfriend. So now we had to learn how to be in relationship. We had to learn how to communicate, how to engage. As they started to be sexual. He'd never had sex. He'd watched lots of porn, so he was just sure he was good at sex. He was not. So we had to learn how to be a sexual being. But he couldn't have an orgasm with her. Because to have an orgasm, you have to relax. You have to give up control. He couldn't trust her because it was women who had hurt him, right? So we worked on all these powerful issues. Time goes by, months go by, and he comes in one day and he tells me that he had told her he loved her, and he had had an orgasm. And I broke my rule. I asked him, what about that porn you used to watch? He said, you know, it's the strangest thing. I went to watch it the other day and I felt sorry for the girl in it. Now, we couldn't have gotten there any other way, right? And Malamuth, the researcher at UCLA, acknowledges that there is absolutely no research at this point that suggests that changing or restricting these sexual fantasies or this, sexually violent pornography in those men at risk reduces their risk. But we can reduce risk by addressing the substance use and the antisocial traits and the misogyny. This is what I call and talk about the development of sexual integrity. I love Doug's work and is so powerful to talk about the principles of sexual health. But I think we can't get there without sexual integrity. You can't have an honest sexual relationship unless you are willing to accept and acknowledge your sexual needs, even those scary, dark ones. As Doug said this morning, it is terrifying to explore the possibility of expressing your sexual needs and having the person you love most reject you. And if you can't do that, is this truly an honest, healthy relationship? Behind the deviant sexual behaviors that we fear are desperate, lonely men using ineffective strategies to seek connection and safety. Ask men to think about their sexuality when they're not turned on. How do their sexual fantasies and behaviors make them feel? If there's shame, and I promise you there always is, that's where you plant your flag, and that's where you start to do the work. Because shame is the secret wellspring from which all of these problems flow. Shame is what prevents men from considering these issues in the light of day. Sam Brownback was a senator in Kansas and a rabid anti-porn activist, and he held hearings where he talked about the dangers of pornography addiction, and he told stories about men that he knew when they checked into a hotel, they had to have the staff remove the television from the hotel room so that in the middle of the night, these guys wouldn't be tempted to watch pornography. Brownback told the story, again, sexual shiny object syndrome, right? He's chasing the porn issue here. Brownback told the story as a way of saying, look how dangerous pornography is. But I tell that exact same story to my patients as a way of saying, look how smart these guys are. They know that in the middle of the night, when they are horny and lonely and tired and away from their family, that they could be tempted to engage in a behavior that they would regret in the morning. So instead of fighting that and shaming themselves, which might make it stronger, they accept it and then make decisions earlier in the day when they're not horny and lonely and tired, so that the next day they don't have regrets. I hold a black belt in Brazilian Jiu-Jitsu, and one of the things that you learn in martial arts is that if you try and fight somebody, it's far less successful than simply redirecting their energy. And that's what I'm talking about here. Rather than fighting these things, let us find ways to redirect them. A man was referred to me. He had been identified as a sex addict by wife, who was not a clinician, but it's okay to diagnose that in everybody else. But wife and two different therapists and pastor. He got caught looking at pornography at work. He was losing his job. I asked him a critically important question, I think. What kind of porn are you watching? Because it really does matter. The porn reflects sexual fantasies and unmet needs within people's lives. I think that's important to know. He said, I'm watching gay porn. Well, why are you watching gay porn at work, dude? Well, I can't watch it at home. Why not? He and his wife had gotten married in the early 80s. When the cure for AIDS, the vaccine for HIV, was heterosexual monogamy. He had had same-sex encounters prior. His wife knew about that, and throughout their entire relationship, whenever she saw him looking at an attractive man, she'd smack him on the leg because she was just sure that he was wanting to go in the bathroom and have sex with that guy. Here's the thing, sometimes he did. He'd go on Craigslist and find men to have casual sex with. He would drive by a dirty bookstore and feel overwhelmed by the urge to go and have sex with another man. Didn't feel like he could control that. On his first session, I asked him to fill out what's called the Klein Sexual Orientation Grid. It is an assessment strategy that invites us to think about sexuality beyond just what you do, but what you'd like to do, what you've done in the past, and who you love and who you fantasize about. He filled it out for me, and he said, wow, he said, I'm bisexual. He said, it's strange, though. I realize I want sex with men more now than I've ever wanted it in my life, and I want sex with men more than with women in a way that I didn't used to. But he said, I'm not at all interested in loving a man. I'm really only interested in loving women, my wife. He's what kids today are calling a hetero-romantic bisexual, which I think is very, very sweet and cute, and it captures all of the sophisticated nuance, the complexity. I gave him that term, and we started working on integrating his sexuality, accepting this bisexuality as part of himself. And he became a man who, when he saw an attractive guy walk by, he could think to himself, nice ass. And then think to himself, there's my bisexuality coming out. Now, he used to be a man who, when he caught himself checking out somebody's ass, he hated himself. On his last day of therapy with me, he said, I used to pray to God to take away these desires for sex with other men. And he said, now I'm thanking God for making me the way that I am, because it gave me a deeper, richer experience of life and sexuality. He could now drive by a dirty bookstore and not feel overwhelmed by this urge, because he didn't spend all damn day suppressing those thoughts, which increased them. Instead, he accepted them and redirected them. Hope I don't fall off the stage back here. Many men have sexual needs and desires that they haven't integrated, that they haven't considered in the light of day, that they're afraid to talk about. Developing empathy and understanding of men who use sex to harm others is not an excusing of their behaviors. It is how we help them learn how to change. Encouraging men to go to war with aspects of their own sexuality, trying to suppress and control it, paradoxically increases the power and strength of those issues. We have to ask ourselves, do we want revenge or do we want change? We only get to choose one. If we want change, we have to find ways to celebrate and acknowledge the unique, positive, wonderful aspects of sexuality that live in men. Thank you.